Hence, we are delighted to have with us our expert speaker, Mr. Sahil, a Dentium engineer who brings deep clinical knowledge and practical insights into CBCT usage. He has helped many clinicians simplify their workflows and make better diagnostic decisions. So do stay with us till the end of this webinar because we have special surprise waiting for you. So without taking much of time, let's get started. Over to you, Mr. Sahil.
Okay, thanks, Miss Komal. Okay, first of all, good afternoon, everyone, and I would like to welcome all the participants who joined today for this session. Okay, so today we are going to talk about the CBCT. So as we are from Dentium, so we have the Bright City with us, and this is, the today's time city because we have used some AI function as well to operate this machine. Okay. So basically, as we know, we already using IOPA and some clinics having RVG, the PSP, and some having the OPG machine as well. So basically, whatever we are getting from those things, that's a 2D image. We know very well. But nowadays, what is the requirement of 3D image? This is the main thing which we are going to talk about today. So as you know, everybody know very well, in 2D image, you know, we are getting this panoramic image and it's like flat image. So whatever we are seeing, it's just a flat image and there are many things which are missing. So to get a accurate diagnose, the accurate treatment and the fast treatment, we need the 3D imaging. That's why, we are into the CBCT. And as you can see here, I can just describe briefly. So basically, when we see 2D images, it's not clearly, bone height, it's visible, but it's estimated. It's not accurate because it is not 1:1 image. So, and same with the nerve canal, it is not properly, it's not clear. It doesn't come clear actually. Even it doesn't come clear, it's not accurate as well. Same with the bone width as well. So as you can see here, there are many things we cannot see and which is not visible in the 2D images. That's why we need the 3D images. As you can see in 3D, like we can see in axial sections, we can see coronal, we can see sagittal. So it's quite easy to diagnose the actual treatment. Just like, for the implant planning, we need the height, we need the weight. Even we have to see the proper canals, we have to see proper sinus. So according to those things, we can plan a implant planning accordingly. And nowadays, everybody knows surgical guide is there and people are using that. So for the surgical guide, we need the DICOM data. It's a must thing. So the DICOM data, we can get it from CT only. It's not possible with the, with that panoramic image like OPG. So nowadays, the surgical guide also is there. So that's why this is the advantage of 3D imaging, not only for implant, even for the endo cases as well, for some trauma cases as well. Even I heard from the radiologist actually, sometime like in the 2D images, this it seems like there's a fracture on the teeth and they're about to extract. But they try to get the CT and they found there is no, fracture. So they just save the teeth. So it happens actually. Sometimes it looks like something in 2D, but in actual it is not. So to save a teeth, it is not only for implant. Just to save a teeth, it is very useful to get the CT done. And nowadays, as I said, we have a like CT nowadays not like the radiation wise also because earlier what was going on like the radiation was higher side in the city, but nowadays we have a new generation in machines, so the radiation also very less. So basically, okay. So as I told earlier, we have a bright city with us, and when we are going to buy or going to get a CVCT machine, what we think? We think about the accuracy, the diagnosis accuracy. It is very must thing. The image quality, the same with the image quality as well. It should be good and easy to use. And the dose, as I said earlier, dose should be lesser because dose is the major thing when we talking about the treatment value for investment. The same thing, the cost wise, the service wise, it should be good investment. So these are some basic things which we think before taking a CVCT. if we are planning to buy. And why are we different if we compare with the other brands? It is due to some, major things are like less dose. As I told earlier, the Bright City, we are having a very low dose. How is it actually the radiation is less? Because, the scanning time is quite less in our machine. And as we are using AI function in the machine as well, not only the software, in the shooting program also we have the AI program, like autofocusing is there, you know and the MAR is there, so we get the more clarity. And in the software we have a AI, as I told. So with the AI it is very useful to get the treatment done. So that's why we are different. And these are some, machine specification what we have. Basically, we in India we have two type of machine, and the major difference is the FOV size. And both the models we have without SAP, with SAP-LO, it depends. But the major difference between 1T and 2TS, that is the FOV size. If we talk about 1T machine, the FOV size is like minimum is 5 by 5 and it goes up to 12 by 9.5. But when we talk about the 2TS, the maximum FOV is 17.5 by 15. 15 is the height that comes with the stitching. Like we have to take two scan and we will get the one scan. But without stitch, it is 9.5 only. So basically, this is the major difference between two models. And one more thing, what we have here, if we compare to the another, brand, the free FOV function is there. You can see here the free FOV 5 by 5 to 10 by 9.5. What is the free FOV actually? See, basically, 5 by 5 is the minimum FOV what we can take. In usually after the minimum FOV, we have to go direct to the higher FOV. It's a common thing. Like in some machine it is 8 by 8, some is 10 by 10 or 12 by 10, like etc. But in our machine also same thing, 5 by 5 is there, 12 by 9.5 is there, but we have a free FOV as well. Sometimes like, you know, we need a like if we are taking 5 by 5, so it covers around 3 or 2, 4 teeth, you know. But sometimes we need to see 6 teeth or the only maxilla or the half jaw, like that. So in that case, there is no need to take full scan. So we can just use the free FOV. We can change the ROI as per our requirement. It zoom in or zoom out according to our requirement. And that's why the scanning time is less and the radiation is less. Even the voxel size, if you're talking about, the minimum is 80 micron, which goes up to 400. Okay. So when we take full maxilla mandible, like full, so like voxel size will be around 150 micron for the higher resolution. But in case if you want more good voxel size, like more good sharpen image you want, so you can come to 120 micron to get the full maxilla mandible. It can be done with the help of FOV. That is there. Again, as I said earlier, the scaling time you can check. It's 11.8 seconds only for panoramic. The CT we have a different 10, 15, 20 according to the voxel size. So this is a major part. Even now with the fast scan, we have a function to take CT in just 6 seconds, 6.6 seconds. Yes. So for post-op, you can just take the CT in 6.6 seconds. It can be done with this machine. It is there. So now, as I said earlier, we have many functions in the software because now we have a limited time for this session. So I just gonna talk about one function which we have in our software, that is a segmentation, AI segmentation. And as you can understand with the name segmentation, what it does actually with the help of AI, we can segment the anatomically we can segment it like maxilla, mandible, teeth, the nerve canal, the sinus. These things can be segmented with the help of AI. Just we have to click and we have to see. I'll show how it works. See, you can check. So we can segment the maxilla, the teeth, the mandible, the nerve canal, the airway as well. And it comes with a different color to understand it clearly. So you can check it here, how it works. See, with the color you can check. This one like for mandible, this is for maxilla, the sinus, and the airway as well is there. And not only the 3D rendering, if you see the 2D, these sections, these. So on the 2D also we see the color. So like we can check the boundary of the, we can check the maxilla boundary, from where it starts, from where it ends, the mandible, even the sinus also we can check the boundary. total. Like it's easy and precise to use, and it is very convenient for the consultation as well. Because when we're talking to the patient regarding the implant planning or anything, so there is no need to discuss about 20 minutes or 30 minutes, or like you have to do manually. So you can just talk with during the talking to them, you can just click and you can wait for that, and it will come automatically, and it is quite precise. So you can see it. You can see here now how it works. See 3D rendering. And yes, here you can check. We have a function, we can hide the things. Like if you want to see only maxilla, you can hide other things. If you want to see only mandible, you can hide other things. Or if you want to just see the teeth, you can do it. So it can be possible. Separately, we can hide or unhide all these things. It can be done. Even the 2D, as I said, you can check the color. Yeah, it is there. Yes, you can see it. So basically, we are getting the reference point as well. When I am saying about 2D, as you can see here, so we are getting the reference point. So with that reference point, we can plan a treatment. Yes. Okay. So apart from that, like we have autofocus function is there. Directly, you can just click on the tooth number and it will focus automatically. Like as I said earlier, there's no need of manual attention. Just click and you will get the particular. You can check it here how it works. Just you have to click. Yes, you can just yes, click. It focus automatically. So it doesn't require the attention to operate this. As well as we are just have this function in actually it's yet to come. Yes, but we are gonna launch it soon. So this is the sinus bone graft function. So with the help of AI, the segmentation part, we can we will get the exact volume of bone graft. So it is possible to do with the help of AI segmentation. It can be done. So this is also very useful in case of sinus, lifting. We will get the actual or accurate idea of the bone graft volume. So it can be done with this software as well. You can see in the image as well. Same, you can see it here. It is showing how much we need the volume to get it done. The placement of implant. The same, as I said earlier, the airway analysis can be done with the software. It is there and it is fully automatic with the help of AI. No need to do anything manually. Just you have to click and you will get all the function, all the things automatically on your screen. And it is very useful nowadays for the ortho cases, even the some sleep apnea cases. It is very important. This thing, the airway. Even I'll show some clinical case as well. In the next slide, you can check with the airway analysis. See, this was the case, before surgery and after surgery. So this was the airway. You can see with the color coding also you can understand. If the color is, lying in the yellow, red, it is narrow. And if it is green or blue, it means it's quite fine. You can check. On the same patient is there. This post-op or pre-op things. So with the help of airway, the treatment was done easily. Same, see, this is another clinical case. You can check it. The occlusal collapse, due to the denture wearing. So the surgery was done. So earlier it was the airway. Just see, it is quite narrow. And after that, after the post-op, it become this. So basically, the airway analysis can be done and it's quite accurate. So whatever data we are getting, it's quite accurate and precise and fast to use. So basically, there are many functions, many other functions are there by which we can use the AI. But in this session, we are just talking about the segmentation part only. So apart from this, there are many functions. So we can go through with that also. And for the, because this session is limited, as I told earlier. So if you want more discussion, more detail, you can just contact your local representative. You can book a demo. The person will visit your clinic and we will give a